Ever found yourself curious about how medical professionals insert an IV into a patient's vein? Intravenous therapy is a fundamental medical procedure, used frequently for administering fluids, medications, and nutrients. Today we'll walk through the process, breaking it down into easy-to-follow steps. Before beginning, ensure you have all the necessary materials. These include sterile gloves to keep the process clean, an IV catheter to administer the fluids, alcohol swabs for disinfection, and a tourniquet to help locate the vein. With materials in hand, you're ready to start the procedure. Patient comfort and safety is paramount during IV insertion. Start by explaining the procedure to the patient to alleviate any fears. Then, begin the vein selection process. Look for a vein that's visible, palpable, and large enough to accommodate the IV. The non-dominant arm is often a good choice, but be flexible based on patient comfort. Remember, a calm patient aids in a successful insertion. Once you've found a suitable vein, it's time to insert the IV. The IV insertion requires precision and care. To begin, ensure the insertion site is thoroughly cleansed with an alcohol swab to minimize the risk of infection. Now apply the tourniquet securely, but remember, it should never be too tight. The next step is crucial: inserting the catheter. Make sure to hold the needle at a shallow angle and to advance the catheter slowly. With a steady hand and a calm approach, you'll feel the catheter slide into place. With the IV successfully inserted, you're almost done. Post-insertion care is just as crucial as the insertion itself. After the IV is in place, secure it using medical tape, ensuring it's firmly attached but not too tight. It's crucial to inspect the insertion site regularly for signs of infection such as redness, swelling, or discomfort. Providing aftercare instructions to the patient is also essential, helping them understand what to do if they experience any unusual symptoms. That's how you insert an IV. Remember, practice under supervision until you're fully confident.